Well, another school year may be winding down, but for one local organization, students' mental health is always top of mind.
Yeah, Communities in Schools of the Dallas region is here to help parents identify some warning signs and some challenges that kids are facing nowadays. Stephanie McGarry is the Chief Clinical Officer. Stephanie, welcome in. Thank you for being with us.
Thank you for having me.
Important conversation to have. What are some of the challenges that you think are facing some young folks these days?
So some of the challenges that we are seeing are really no different than what we've been seeing a while. It's a lot of stress that are going on with our kiddos, a lot of pressure, especially academically. We've just finished up testing season, so a lot of our kiddos were worried about how well they're doing. A lot of uncertainty too with what's going on in the world. Sometimes we think our kids aren't paying attention, but they really are. And so all of this happening at one time, so things that are happening in different parts of their community is affecting them in their mental health, and we're seeing that.
So what are some of the warning signs that parents and caregivers should be watching for in terms of their children?
So one thing they really want to pay attention to is any changes in behavior. We always want to empower parents and guardians that they know their kids way better than we do. So paying attention to any shifts that you see, and specifically looking at the difference in frequency, intensity, and duration. Because a lot of parents will say, well, how do I know if they're just being a regular
13-year-old? Exactly. They're 13 now.
Exactly. Or if there's something I really need to be paying attention to. So we'll say, think about their behavior. Is it lasting longer than it typically would?
That's
if
a red flag.
they usually get over it in one day and you start to see it kind of happening over, pay attention to that. If it's more frequent, if it's more intense, then that's when you want to check in.
So how is your organization, Communities in Schools of the Dallas region, how are you all specifically helping with these mental health challenges with the youth?
So we have an amazing team. CIS, we are celebrating our 41st year. We have a team of site coordinators that are on over 60 campuses that support students in academics, behavior, as well as attendance. And so we absolutely believe in that one-on-one relationship and that students feel like they have someone that they can listen to them and also provide them the resources that we need. So our site coordinators provide that one-on-one relationship, while our mental health professionals provide counseling for those students that really need that extra support to the students for free on those campuses as well.
Well, and you mentioned the campuses though, but now that school is out or about to be out for so many kids, what kinds of resources are available to these children over the summer?
There are tons of resources. I love Dallas. I'm a Dallas native, and we have done an amazing job of making sure that our children are safe during the summer, mentally and physically. So I always recommend that parents look at their local parks and recreation centers. There's a teen all access pass that makes sure that they have something fun, because our kids have been, their stress systems have been activated all school year, and they need a moment of reprieve. And so checking into their Dallas, the public library, making sure that there are free resources there, as well as when we're talking about mental health, being aware of what their local mental health authority is, so whether that's MetroCare, just in case there is some support that's
needed. And lastly, real quick, how can folks get involved if they'd like to lend a helping hand?
Absolutely. They can look at us at cisdallas.org to learn more about our programming during the school year, as well as how we're supporting the community during the summer.
Stephanie McGarry, thank you so much. We really appreciate you being with us today.
Thank you so much.